Good morning, guys. I hope we're all sparkly. I'm hoping the production value of this video is a little bit better than my previous ones because I have a new phone. We don't have a fancy backdrop. We don't have special guests because that's not the purpose of this video log or this channel. It's merely to give you a sense of perspective in a distorted world. Maddie. So let's tackle the topic at hand. Does testosterone make you aggressive? Now, the answer to this is on a well-balanced TRT protocol, you should feel balanced. You should be cool, calm, collected. You should be confident, and you should realize that actually there's no need to be aggressive. Is that true? Well, perhaps in certain circumstances where your life is being threatened, that of your siblings, offspring, nearest and dearest. Yeah, let's lay down. But in the majority of situations, aggression is inappropriate. Why? We are supposed to live in a civilized society. Our higher state of consciousness should mean we don't need to resort to fisticuffs or keyboard warriors, telling people this is what I'm going to do to you. Grow up. Honestly, it really is childish and immature. And it shows a level of insecurity that actually reveals your true character. So when we talk about hormones and aggression, why? Why are you aggressive on testosterone replacement therapy? It's because your dose is too high. Now, you do need testosterone for drive and determination. But when your levels are too high, it comes at the expense of empathy, insight, and understanding. You don't want to be switched on when you're supposed to be chilling with the kids. You're supposed to be able to relax. You're supposed to use an appropriate amount of energy, excitement, aggression, at an appropriate situation. So when you're banging it in the gym, yeah, let's be aggressive. But in the majority of situations, you want to be cool, calm, and collected. Now, humans communicate. Apparently, we should learn to communicate effectively, but our opinions distort the model. We think our opinions are more important than the other person's opinion. And when you run high, you think your opinion really is the most important opinion. And I don't care if they make sense. I don't care if they present a logical argument. Me, I'm important, or is it impotent? What you need to understand is the needs of the collective outweigh the needs of the individual. So if you're promoting dogma, and somebody presents you with a logical argument why that dogma is not true, you should listen. But you need to protect your ego, because your ego is all you've got. Cool, calm, and collected. Now, we distort our physiology with our psychology. We should be looking to address our physiology to improve our psychology. At our core, we are base animals, gifted with a higher state of consciousness. And what have we done with that? We are destroying the world. Now, all other species within the animal kingdom need to survive. They have a survival need every single day. Now, we've removed that from our society, but we're still left with our internal drives. So when you come to hormone balance and you think, let's just whack up the dose, and it distorts your physiology, causes a rise in hematocrit, a deterioration in your lipid profile, a rise in blood pressure, the psychological impact of these high levels causes you to be an arsehole. We don't want you to be an arsehole. So please, normal physiological levels, because, as I always say, you are designed to fight and fornicate. Whilst obviously a trivial comment, it's true. Your DNA wants you to be strong enough to attract a mate, have the ability to procreate, and then look after that offspring to further your DNA to the next generation. You don't need to have high levels to be a man, because a true man is judged by his character and his actions. And when you think you're more important than the rest of the people in the planet, you are out of touch. So we all know the guys down the gym who are banging in gear and banging in too much testosterone on the internet. They're idiots. They're tolerable for about 10 minutes. But after that, I'm going to say it, give me strength. You should be able to be considered, because we are in a community, and that community, whilst distorted, is still important for a survival need. So, is there anything more to say? Yeah. Let's talk about hormonal fluctuations, because our psychology cannot appreciate hormonal fluctuations. Now, a good example of that is PMT in women. It happens most months, and their psychology gets distorted irrespective of the knowledge that it's about to happen. So when we think about melandrin levels, when you start testosterone replacement therapy, there is a titration process. Now, you need to achieve stable levels within the body. Now, if that's HCG, that's normally about 11 days. And if that's testosterone CYP, it's normally between 4 and 8 weeks. You then need to adjust your protocol to optimize those levels for a sense of well-being and normalizing physiology. Now, physiology adapts. When you give it a hormone, it has no other option than to adapt. So it is a complicated process, but it is less is more, and slowly, slowly, slowly. We need to be proactive, not reactive. The modern healthcare system is reactive because it's struggling under the weight of demand from people and an unwillingness to look at prevention over cure. Much like when we think about the antidepressant story. You go to the doctor's only got 5 minutes, I'm depressed. Well, the computer says give antidepressants. I don't think I'm depressed, doctor. Well, you tick all the boxes and I'm the doctor, so have antidepressants. I don't want them. Well, I can't help you. What about testosterone? Oh, I don't think you need to worry about that. Oh, doc, please, please, please. So they do a testosterone. It comes back within range. Yes, doc, but I'm not 80, I'm 25. Well, you're within range. So we do live in a very regressive healthcare system. So we are trying to effect a positive change, but it's going to take time, and it starts with the individual. So hormonal fluctuations, they will cause a disturbance in the force because they have to. They are causing a disruption or alteration in your physiology, and that manifests with a psychological symptom. So testosterone and aggression, You shouldn't feel aggressive on a well-balanced TRT protocol. If your testosterone is too high, you can feel aggressive. And paradoxically, you can feel lethargic, as if you've got low testosterone. Sometimes the symptoms of high and low are very similar. It's almost like a bell-shaped curve. You can feel irritable with low testosterone. What's that all about? So when you've got low testosterone, you normally present with an element of low mood, anxiety and depersonalization, tiredness, low libido. So what are you irritable about? You're irritable because there is a distortion between anabolic hormones and catabolic hormones. So if you have an elevation in catabolic hormones, you are going to be irritable. If you correct these levels and bring balance and harmony back to the body, you should feel balanced and hopefully no longer irritable. Now, irritability, anger, and all these negative emotions are multifactorial, but we should always look to address the foundations. Super important. So, does TRT make you aggressive? No, not on a well-balanced TRT protocol. If you're aggressive on a well-balanced TRT protocol, sort it out, because you're an idiot.